You lie down, close your eyes, but before you know it, the clock shows 2 a.m. again. You're wide awake, restless, and exhausted by morning. It's not just stress or getting older. There's a hidden, often overlooked reason your sleep keeps breaking, a change inside your body that most doctors don't mention. Today, we're revealing this secret cause and simple steps you can take to finally sleep through the night. As we age, our bodies go through many subtle but profound changes, and one of the most impactful is how our sleep architecture shifts. Even if you don't have a diagnosed sleep disorder, these biological shifts can quietly sabotage your ability to sleep deeply and continuously through the night. Part 1. What happens to your sleep cycles as you age? Sleep isn't just one uniform state, it cycles through stages including light sleep, deep restorative sleep, known as slow-wave sleep, and REM sleep, the dream phase. After age 50, studies show a marked decrease in the amount of deep slow-wave sleep you get. This phase is critical because it's when your body repairs tissues, strengthens the immune system, and consolidates memories. With less deep sleep, your nights become fragmented. You wake up more often without realizing why. This disruption leaves you feeling unrefreshed and fatigued the next day. Part 2. The role of melatonin, your sleep hormone. Melatonin is often called the sleep hormone because it regulates your internal clock, signaling to your body when it's time to wind down and rest. After 50, melatonin production naturally declines. The pineal gland's sensitivity to darkness reduces, making it harder to fall asleep quickly and maintain deep sleep cycles. This decline explains why older adults often experience earlier bedtimes and wake up earlier than younger people. But if melatonin drops too low or becomes out of sync, your sleep cycles become fragmented and irregular. Part 3. Cortisol and the stress response. Cortisol, the body's main stress hormone, follows a daily rhythm opposite to melatonin. It rises in the morning to wake you up and falls at night to let you rest. However, chronic stress, anxiety, or health issues common in midlife can keep cortisol levels elevated in the evening. Elevated cortisol late at night disrupts your ability to fall asleep and stay asleep. It triggers alertness and can even cause nighttime awakenings, leaving you restless. Part 4. Changes in body temperature regulation. Your body's ability to regulate temperature also changes with age. Normally, body temperature drops slightly at night to encourage sleepiness. But after 50, this drop becomes less pronounced, making it harder for the brain to trigger the feeling of sleep readiness. This can lead to difficulty falling asleep and frequent awakenings. This biological cocktail, reduced melatonin, elevated cortisol, fragmented sleep cycles, and altered temperature regulation, forms the hidden foundation of why sleep often becomes elusive after 50. While biological changes create the foundation for disrupted sleep, external lifestyle and environmental factors often amplify the problem. The good news is many of these are within your control, and making targeted adjustments can dramatically improve your nights. Part 5. Diet's hidden impact on sleep quality. What you eat and when you eat can influence your sleep far more than many realize. Consuming heavy meals, caffeine, or sugar late in the day can interfere with your body's natural wind-down process. Caffeine, found in coffee, tea, chocolate, and many sodas, blocks adenosine, a brain chemical that promotes sleepiness. Its effects can linger for 6 to 8 hours, meaning a late afternoon cup of coffee can still disrupt your sleep. For adults over 50, caffeine metabolism slows down, making them even more sensitive. Sugar spikes blood glucose, triggering the release of adrenaline and cortisol, stress hormones that keep you alert. Over time, this can condition your body to stay in a heightened state of arousal, making falling and staying asleep difficult. Heavy or spicy dinners can cause indigestion or acid reflux during the night, causing discomfort and awakenings. Ideally, your last meal should be light and consumed at least 2 to 3 hours before bedtime. Part 6. The role of alcohol, friend or foe? While a nightcap might seem to help you fall asleep faster, alcohol actually fragments sleep later in the night. It suppresses REM sleep, the phase crucial for emotional and cognitive restoration. After the alcohol wears off, you're likely to experience lighter, interrupted sleep and early awakenings. For adults over 50, alcohol's effects on sleep are even more pronounced due to changes in metabolism and increased sensitivity. Reducing or eliminating alcohol in the evening can dramatically improve sleep continuity and quality. Part 7. Screen time and blue light exposure. The glow of phones, tablets, and televisions emits blue light, which tricks your brain into thinking it's daytime. This suppresses melatonin production and delays the onset of sleepiness. Many adults over 50 use screens in the evening to unwind, but this habit can backfire by delaying your internal clock and fragmenting sleep. To counteract this, consider using blue light filters on your devices, avoiding screens at least 1 hour before bed, or switching to reading printed books or listening to soothing audio instead. Part 8. The sleep environment matters. Your bedroom should be a sanctuary for rest. Noise, light, temperature, and even the quality of your mattress and pillows can affect sleep. For optimal rest, keep your room cool, around 60 to 67 degrees Fahrenheit or 15 to 19 degrees Celsius. Use blackout curtains or eye masks to block light. Minimize noise with earplugs or white noise machines. Invest in a comfortable mattress and pillows that support your preferred sleep position. Making these changes helps signal to your brain that it's time to sleep and reduces disruptions during the night. Addressing these external factors alongside your body's natural changes can create a powerful synergy, helping you reclaim deep, restorative sleep. When it comes to reclaiming restful nights, natural approaches can be powerful allies, especially when paired with lifestyle changes. Let's explore effective remedies and routines backed by science that can ease your body and mind into deep, uninterrupted sleep. Part 9. The power of a consistent sleep schedule. Your body thrives on routine. Going to bed and waking up at the same time every day, even on weekends, helps regulate your internal clock, or circadian rhythm. For adults over 50, consistency can compensate for the natural shifts in sleep hormone production. Establishing a relaxing pre-sleep ritual signals your brain that it's time to wind down. This might include dimming lights, reading a book, practicing gentle yoga or meditation, or listening to calming music. Avoid stimulating activities, intense discussions, or stressful work right before bedtime. Part 10. Herbal helpers, chamomile, valerian, and lavender. Certain herbs have long been used to promote relaxation and sleep. Chamomile tea, rich in antioxidants like apigenin, binds to receptors in the brain to reduce anxiety and initiate sleepiness. Studies suggest chamomile may modestly improve sleep quality, making it a gentle choice for older adults. Valerian root is another natural sedative that can shorten the time it takes to fall asleep. It may also reduce night awakenings. However, it should be used cautiously and discussed with a healthcare provider, especially if you take other medications. Lavender aromatherapy has been shown to improve sleep quality by lowering heart rate and blood pressure. A few drops of lavender oil on your pillow or using a diffuser in your bedroom can create a calming atmosphere conducive to rest. Part 11. Melatonin supplementation, what you need to know. Melatonin supplements are widely used for sleep difficulties, particularly when natural production declines with age. Low-dose melatonin taken 30 to 60 minutes before bedtime can help reset your sleep-wake cycle and improve sleep onset. However, melatonin is not a sedative. It works best for people with circadian rhythm disruptions, such as shift workers or those experiencing jet lag. For chronic insomnia, it may have limited benefit. Consult your healthcare provider before starting melatonin, as the appropriate dosage varies and it can interact with certain medications. Part 12. Magnesium for muscle relaxation and sleep quality. Magnesium is essential not just for muscle function, but also for calming the nervous system. Magnesium deficiency can cause restless legs, muscle cramps, and difficulty falling asleep. Taking magnesium supplements, or consuming magnesium-rich foods like nuts, seeds, leafy greens, and whole grains, can improve sleep quality. Magnesium citrate and glycinate forms are often preferred for their higher absorption. Part 13. Mindfulness and breathing exercises. Practicing mindfulness meditation and deep breathing can reduce stress hormones and quiet the mind before bed. Even just 10 minutes a day can lower cortisol levels and improve sleep latency. Techniques such as the 4-7-8 breathing method, inhale for 4 seconds, hold for 7, exhale for 8, activate the parasympathetic nervous system, promoting relaxation. Part 14. Avoiding common sleep disruptors. Avoid heavy exercise close to bedtime, as it can raise adrenaline levels. Also, try not to nap excessively during the day, especially late afternoon, which can interfere with nighttime sleep. Limiting fluid intake in the evening reduces nighttime trips to the bathroom, a common sleep disruption in older adults. By weaving these natural remedies and bedtime habits into your routine, you create an environment where your body can rebuild its natural sleep rhythms, leading to deeper, more restorative rest. As you age, sleep challenges often become intertwined with other health conditions and lifestyle factors. Addressing these with a comprehensive approach can dramatically improve your nights and overall well-being. Part 15. The importance of regular physical activity. Exercise is one of the most powerful natural sleep enhancers. Moderate aerobic activities like walking, swimming, or cycling can increase total sleep time and the amount of deep sleep you get. Exercise also reduces anxiety and depressive symptoms, both common culprits of poor sleep. Timing matters. Aim to complete workouts at least 3 hours before bedtime to avoid stimulation that can delay sleep onset. For strength training, light resistance exercises help reduce muscle tension and improve mobility, indirectly benefiting sleep quality. Part 16. Managing chronic pain and discomfort. Pain is a significant sleep disruptor, especially in adults over 50. Conditions like arthritis, neuropathy, or back problems can cause nighttime awakenings and difficulty falling asleep. Effective pain management, whether through physical therapy, appropriate medications, or complementary therapies like acupuncture, can reduce discomfort and improve sleep continuity. Discuss pain control options with your healthcare provider to find strategies that minimize side effects interfering with sleep. Part 17. Sleep apnea and breathing disorders. Sleep apnea, characterized by interrupted breathing during sleep, affects many older adults and can cause loud snoring, gasping, and excessive daytime fatigue. If you frequently wake up choking or feel unrest despite spending enough time in bed, a sleep study may be necessary. Treatments such as CPAP machines, oral appliances, or lifestyle changes like weight loss can dramatically improve sleep quality and overall health. Part 18. Limiting exposure to evening stressors. Emotional stress in the evening, whether from work worries, family issues, or financial concerns, can elevate cortisol and disrupt sleep. Practices like journaling to offload your thoughts before bed, engaging in relaxing hobbies, or seeking professional counseling can help manage stress. Incorporating mindfulness and gratitude exercises fosters a positive mindset conducive to restful sleep. Part 19. The role of light exposure during the day. Daytime exposure to natural light helps regulate your circadian rhythm. Spending at least 30 minutes outdoors, especially in the morning, reinforces your body's internal clock and supports melatonin production at night. If going outside is difficult, using a light therapy box in the morning can be effective, especially during winter months when daylight is limited. Part 20. Avoiding medication-induced sleep disruption. Many common medications for blood pressure, heart disease, allergies, or depression can interfere with sleep. If you suspect your medication affects your rest, talk to your doctor. They may adjust the dosage or timing, or suggest alternatives with fewer sleep-related side effects. By integrating regular exercise, managing medical issues, optimizing stress levels, and maximizing natural light exposure, you create a powerful foundation for deeper, more consistent sleep. What you eat, and when you eat it, plays a crucial role in your ability to sleep soundly. After 50, optimizing your diet to support your body's changing needs can improve sleep quality and overall health. Part 21. Foods that promote relaxation and sleep. Certain nutrients directly support the production of sleep-promoting hormones and neurotransmitters. Tryptophan, an amino acid found in turkey, chicken, nuts, seeds, and dairy, helps your body produce serotonin and melatonin, the chemicals that regulate sleep and mood. Magnesium-rich foods such as spinach, pumpkin seeds, and almonds relax muscles and calm the nervous system, preparing your body for rest. Complex carbohydrates like quinoa, sweet potatoes, and brown rice increase the availability of tryptophan to the brain by triggering insulin release, which helps shuttle competing amino acids away. This balance encourages the brain's production of melatonin. Herbs such as chamomile and valerian root can be enjoyed as soothing teas in the evening to encourage relaxation. Part 22: Foods and Substances to Avoid Before Bed. Heavy, spicy, or greasy meals can cause indigestion and acid reflux, disrupting sleep. Similarly, caffeine, even in the form of green tea or chocolate, should be avoided at least 6 hours before bedtime due to its long half-life in older adults. Alcohol, though it may initially induce drowsiness, interferes with REM sleep and leads to fragmented rest. Limiting fluid intake 2 to 3 hours before bed reduces nighttime bathroom visits, a common cause of sleep interruptions. Part 23: Meal Timing and its Impact on Sleep. Eating too late can interfere with your circadian rhythm and hormone balance. Ideally, finish your last meal 2 to 3 hours before bedtime to allow for digestion and prevent discomfort. For some, a small, balanced snack containing protein and complex carbs, like a small handful of nuts with an apple, before bed can stabilize blood sugar levels and prevent night awakenings caused by hypoglycemia. Part 24: Hydration and Sleep. Proper hydration supports cellular repair and detoxification during sleep. Dehydration, however, can cause leg cramps and restless nights. Drink water steadily throughout the day but taper off in the evening to avoid excessive nighttime urination. Part 25: Supplements that may support sleep. In addition to melatonin and magnesium, some people benefit from supplements like L-theanine, an amino acid found in green tea, promotes relaxation without drowsiness. 5-HTP supports serotonin production, improving mood and sleep. Glycine, an amino acid, can help lower body temperature and promote sleep onset. Always consult a healthcare professional before starting supplements, especially if you're on medications. Optimizing your nutrition and meal timing creates a supportive internal environment that helps your body's natural sleep mechanisms function more efficiently. After exploring the hidden biological shifts, external lifestyle factors, natural remedies, medical considerations, and nutrition strategies, it's time to bring it all together. This final block provides a clear, actionable plan you can follow to reclaim your restful nights and energize your days. Part 26: Key Takeaways: Understanding your sleep changes. After 50, natural declines in melatonin and shifts in cortisol disrupt your sleep cycles. External factors like diet, screen time, stress, and environment amplify sleep fragmentation. Medical conditions such as chronic pain and sleep apnea are common but treatable causes of poor sleep. Regular exercise, mindfulness, and natural supplements can restore relaxation and deep sleep. Balanced nutrition and thoughtful meal timing optimize your body's ability to produce sleep hormones. Recognizing these factors empowers you to address your unique challenges with confidence and clarity. Part 27: Your Personalized Sleep Improvement Plan. Set a consistent sleep schedule, go to bed and wake up at the same times daily. Create a relaxing bedtime routine, dim lights, avoid screens, and practice calming activities like reading or meditation. Optimize your sleep environment, keep your bedroom cool, dark, quiet, and comfortable. Mind your diet, avoid caffeine, alcohol, and heavy meals late in the day. Include sleep-supporting foods rich in tryptophan, magnesium, and antioxidants. Exercise regularly, aim for at least 30 minutes of moderate activity most days, but avoid intense workouts close to bedtime. Manage stress, use journaling, mindfulness, or professional support to reduce evening anxiety. Consider natural supplements, consult with your healthcare provider about melatonin, magnesium, or herbal remedies. Address medical issues. If you suspect pain, sleep apnea, or medication side effects, seek professional evaluation. Limit naps and evening fluids to improve nighttime sleep continuity. Get daylight exposure. Spend time outside each day to reinforce your circadian rhythm. Part 28: Staying Motivated and Tracking Progress. Change takes time. Sleep patterns often improve gradually over weeks to months. Keep a sleep journal to track your bedtime, wake times, diet, exercise, and how rested you feel. Celebrate small victories, like fewer night awakenings or feeling more refreshed in the morning. Remember, improved sleep is foundational to better health, mood, and quality of life. When you prioritize sleep, everything else, energy, memory, immune function, improves. Part 29. When to seek professional help. If after trying these strategies you still struggle with chronic insomnia, excessive daytime sleepiness, or loud snoring, consult a sleep specialist. Conditions like sleep apnea, restless leg syndrome, or depression may require targeted medical interventions. Sleep is too important to ignore, and help is available. Part 30. Final encouragement. You deserve nights of peaceful, restorative sleep. Aging may bring changes, but with knowledge, intentional habits, and support, you can reclaim the deep, rejuvenating rest that fuels your best days. Start today with one small step, and watch your nights transform.